especially who came all the way from Australia, the land down on the beautiful country. Thank you so much for having me. My name is Ann Jung, the Overseas Business Division Head of Geneuin-Tech. Actually, we are the high-tech bio company which has 5 types of recombinant virus technology. Geneuin-Tech was established in 2015 by a smart and beautiful lady CEO, Professor Han, as a gene therapy company with the idea of restoring the original human form by treating genes that are the fundamental cause of disease. Our CEO, Professor Han, served as the virus facility head of KIST. I think everybody knows about KIST, Korea Institute of Science and Technology. And at KIST, she successfully carried out the mission of facilitating virus facility and developing 5 types of recombinant virus technology. And she worked for the Genetic Engineering Institute of Seoul National University and also at Takara Bio Japan. She has experience in the field of virus concentrate and purification technology. I want to say that she has many experiences in viral vector research and gene therapy in various government bodies and also bio companies. Okay, the next slide is about our Genuine-Tech. So we have many platforms and also pipelines through our core technology, which is, I mentioned earlier, recombinant virus technology. Vaccine development was established by developing an influenza vaccine when Korea was suffered greatly from the bird flu, avian flu in 2016. And in the event of COVID-19 outbreak in 2019, it was possible for us to start development using this platform. Okay, this is about our intellectual property rights, vaccine production cell line, also gene therapy and CAR-T treatment as well as cell therapy have been registered at home and abroad. We are a small company, but though we have patents, numerous patents and PCT also, we are currently entering the United States, Europe, and China. And as you can see, the COVID-19 vaccine patent has also been applied for patent under 2 categories. Okay. Now I explain about our COVID-19 vaccine platform. As we experienced more than 2 years of pandemic situation, we got to know that regular vaccination is required, especially for the elderly who are at high risk. Maybe we all should get vaccinated later soon, every year, like the influenza vaccine. From next year, it is expected to go into an endemic situation. And even if half of the population infected, the virus is still going on continuously. Therefore, we urgently need a vaccine against the endemics. But as we all know that the current vaccine have problems with side effects and breakthrough infections. When it comes to breakthrough infection, as we all know, the mucosal immunity is the key. Of course, antigen mutation is also the kind of key cause. However, breakthrough infection can be prevented significantly if it's blocked by mucosal immunity. Yes, most vaccines have a booster shot effect, but it does not induce mucosal immunity. So the virus goes into the lung and a breakthrough infection occurs. But our Genuine-Tech vaccine will induce a super immune IgA mucosal immunity, which is very similar to a natural kind of infection cure. And it significantly reduces the breakthrough infections. Okay, I'll explain more about the next slide. Okay, this is about in vitro and in vivo data for Genuine-Tech, our company's COVID-19 vaccine. We've checked the antigen and antibody neutralization reaction of adeno-COVID-19, which is similar to actual antigen. And the test data showed that the defense effect was much better, like an adjuvant, when used in combination with the antiviral. As a result of confirming antibody expression by injecting adeno-COVID-19 into experimental mice, it was confirmed that antibodies were formed more effectively when injected with nasal inhalation than with muscle injection. Okay, this means that only a small titral vaccine will have a sufficient defense effect, so it's expected that production cost can be lowered and the side effect of thrombosis also can be significantly reduced. We strongly believe that our Geneuin-Tech's kind of vaccine platform will be the next future endemic vaccine platform. Okay. Next, I'll explain about the as you can see, AstraZeneca and Janssen have been approved for the same vaccine platform as ours, but they use 293 cell. Although we are a small company, we have prepared and built an outstanding vaccine platform for many years that can respond quickly with our own production cell line and nasal inhalation method. Okay, to produce biopharmaceuticals is required a safety-proven cell line. The main cell line used in the production of a recombinant adenovector vaccine is right now 293 cell, as you know. But the 293 cell line has a high response to RCA. Doctor, you know already about that, right? Has a problem that can cause cancer when self-cultured several times. But 293 cell commonly used because there's no alternative production cell line. GT541 developed by Jinyuintek is a safe production cell line that does not respond to RCA. Our production cell line, GT541, has the advantage of stabilizing gene expression using retrovirus in human normal cell. Currently, hamster origin CHO cell used by most domestic and foreign companies, bio companies, is also not human cell. So it has a problem that can cause immune response. Our GT541 is suitable as vaccine production cell line and is a safe and effective production cell line that can solve the side effects of thrombosis, blood clots, and anaphylaxis. This is RCA reaction test result, as we can see. As a result of checking the RCA response through 18 subcultures, 293 cell showed RCA band, but as you can see, our GT541, there's no band. It was confirmed that there was only little differences from 293 cell in terms of virus production efficiency. As you can see, the green color, the 293 cell, and the comparison of GT541. Okay, this is about our gene therapy. Actually, we have many platforms through our core technology. This is our gene therapy for the treatment for the rare ophthalmic kind of diseases. Gene therapy for the hereditary retinal disease and macular degeneration, we call AMD, age-related macular degeneration. So far, there is no known treatment for hereditary retinal diseases. And the effect has not been proven, so it is usually recommended only as a supplementary treatment. We are co-developing with Seoul National University's ophthalmic clinical team and selected genes by analyzing big data on patients with hereditary retinal disease in Korea. In addition, we've currently conducted efficacy and also safety tests on animal mice using the AAV vector that we've developed. Okay. We selected the serotypes with good transduction efficiency and cell viability from various serotypes and confirmed quantitative evaluation of GFP expression in retinal cells. And as you can see, abnormalities in ocular tissues in animal tests, the transduction of genes is good with no tissue damage. Okay, continuously. This is in vivo test. 1 microliter was injected by the subretinal method to 4-week-old rat mice with damaged retinal layer. when we evaluated the structure of the retina by taking fundus photo and OCT, for each time period, there is no special inflammation or findings. It means our GT510 is considered quite safe. Okay. The expression of a PDE6 beta was confirmed by IF staining and also IHC, which is this method, and the formation of the retinal layer that did not exist before was confirmed. It's quite outstanding. Okay, this is about our CAR-T, the new type of CAR-T cell therapy. A common CAR-T cell therapy is treatment that allows T cells to effectively recognize and kill tumor cells by expressing antibodies that bind to tumor antigen in T cells. CD19 gene is mainly being used. However, CD19 CAR-T is easy to apply to blood cancer, but not solid cancer. Okay. Geneuin-Tech's CAR-T cell recognizes the D-alpha, which we say the death receptor 4 in tumor cell. It increases the ability of T cell to kill cancer cell itself while also transmitting source-side signal from tumor cell itself, having a strong cancer cell death effect as a dual action, which means like a cytotoxic effect and apoptosis. The strong dual action can block the problem of tumor cells, converting into resistant tumor cells through mutations. Okay, next slide. Okay, CAR-T continuously. We selected the cancer cell lines that express a lot of D-alpha genes in various cancer cells, and 6 types of cancers were selected through facts that the D-alpha gene expressed a lot on the surface of cancer cells. And we checked whether D-alpha is expressed in CAR-T with a test method, Western blot, and confirmed D-alpha expression on the surface of a human CD8 T cell with VAX. We also confirmed that the effectiveness of cancer cell death by measuring the cytokines caspase-3 and caspase-8 produced in the apoptosis process with treating human anti-D-alpha CAR-T in the selected cancer cells. Okay, this is another data for that. This is also in vivo test. It was confirmed that our CAR-T worked to increase the survival rate and was also effective in solid tumor, not only for the blood cancer. Currently, we are testing on animals for lung cancer, and efficacy and safety tests are expected to be confirmed soon. When we have data, we can update to you more. And okay, this is the last slide. We have established the optimal production conditions for our CAR-T in human blood. That's why we can say that. Thank you so much for listening, and thank you so much for your precious time and your kind of attention. And if you have a question, please do come and visit. Our booth is L23 down there. Please come and visit, and our smart and beautiful professor will answer any of your questions. Okay, thank you so much. Have a great, wonderful day.